we look at that tripod in the foot. So heel, pinky toe, knuckle, big toe, knuckle, and the foot, they're more up here, right? So I don't know if you can see this little thing in here. So looks like a ceiling fan, but it's basically some paper clips I taped together here to make a little spring. So you imagine that kind of, bend it here a little bit. All right, there we go. So it kind of has a little springiness. That's what you imagine your foot, like a chicken's foot or something. Okay, so two in the where your knuckles are in the front, big toe, outer toe, inner toe, big toe, pinky toe, however you want to look at it, and the heel. And that maps out. So hip back, seatbelt, kind of pull the pelvis back. That's your obliques. Kind of twist and sit and hinge the hip. Sit back, load that glute. Push that knee out. That's going to be glute med on the side. Imagine a band there, maybe to strengthen that if you need to. And that's with the flex, with the bend, okay? We use that muscle too to hike the hip when we're up here, but if we don't get a good foundation at the bottom, it's gonna be tough to train that as well, okay? So this is where we can kind of imagine things kind of spreading out and maybe trying to strengthen. So I do have a band here, I'll just go ahead and show that. That way I don't want to make another video maybe. Two birds with one stone maybe here. So I could do this as a dual, out and in. So my feet are grounded, all 6 points, 3 and 3. Hips back, knees out. So glute max in the back, glute med on the side as I hinge those hips. Okay, if I go into a stride, don't trip yourself up. Get that little tail out of the way here. So I'm creating some space. See, my knees are going out wide, out towards, forward and out. Here. Here, alternating like that, see? Okay, so there's that. And then the third piece is the inner thigh, and really use your body weight for that. As you hinge the hips go back, chest goes forward, opposite, right? Knee goes out, inner thigh controls on the inside, right? That's not really a piece to pull in. It's more of, as you lift up, everything draws in more from the core and the inner thigh over that big toe knuckle. So we don't have 4 points, we only have 3. So it doesn't really balance out quite so perfectly, but it works. So heel, outer pinky toe, we're anchoring the big toe with a post up off of, leverage off of, everything naturally draws in as we rotate, kind of locking, unlocking the knee as a rotation. Twists in, pulls in, tube of toothpaste, squeeze in up through the spout, inner thigh core. So just pushing back out, it's almost like back pocket to chest or breast pocket. Boom. Boom. But it's that squeeze in versus the press out and the tuck back. Boom, boom, boom. You can just connect those dots. Zoop, boom, boom, boom. Okay? And if we were to splay out that foot, the tripod, and kind of look down the middle, this is exaggerated. But imagine like a lot of older folks when they go to the restaurant, they have to whip out their reading glasses, magnify the font so that it makes it bigger so they can see it. So you may have to exaggerate this so you can feel it. So you want to try to magnify. So imagine like you're creating this 3D. It's almost like this kind of spiral that you're like a spiral staircase, and you're gonna follow it like threads on a screw. Okay, but you can look down the center of it, right there to the arch of your foot, right in the middle, and you're gonna lower your weight like center of gravity down here. Your chest button here, so the big toe knuckle, and you're gonna lower as you go down, right down the center, and right back up. Open, closed up, right? Wide, narrow. Wide, narrow, see? And you just want to have that sense of your straight up and down, right over your balance point, the arch of the foot. And so that's how you can kind of, keep your balance and practice your shifting and walking and all that.